Good morning, everybody. I'm Joanne Kenen. I'm the healthcare editor of Politico Pro. Thank you for joining us this morning, and a big thank you to everybody who's tuning into our live stream. Today, we're looking forward to our Politico Healthcare Breakfast Briefing, the current policy landscape, and it's our first health event of the year. It could not come at a more timely moment, and we should have a great panel conversation today. We have a dynamic group joining us. On stage, we're going to have Representative Xavier Becerra, from the chairman of the Democratic Caucus and a member of the Ways and Means Committee. We'll have Representative Renee Ellmers, who's a member of the House Energy and Commerce Subcommittee on Health. Andrew Hyman joins us. He's a senior program officer at the Robert Wood Johnson Foundation. And Steve Parente is from the Minnesota Industry Chair of Health Finance. He's in from Minnesota. And before we kick things off, I want to say thank you to our sponsor for today's event, Americans Health Insurance Plans. We appreciate your partnership with us at the Politico Healthcare Breakfast Briefings. This event will cover important topics driving the healthcare conversation, and we thank you for making it possible. And a few housekeeping notes before I bring them on. We want this to be a very interactive conversation, so please join the conversation on Twitter at #PolicyConf, C-O-N-F. We'll be monitoring your questions from a tablet on stage, so feel free to start tweeting. Please turn your phones to mute. And without further delay, I'd like to welcome our panel. Let's start with the two members of Congress we have this morning. We are less than a month before the end of the enrollment period. You as a supporter of the law, and you as an opponent of the law. Start with you. What do you need to see happen in the next, whatever we are, 25, 26 days?
Joanne, well, first, thank you for inviting. Appreciate being here. Looking forward to a discussion with Renee and our two colleagues. I would say this: between now and March 31st, ramp it up as much as we can so as many people as possible can say they now have the health security that they didn't have before. Try to make sure that what we do is build on those pillars that give us an economy that works for all Americans. And you can't have an economy that works for all Americans if people are concerned that if they take their child to the doctor, they may end up having to file for personal bankruptcy. So the more we can try to encourage folks who qualify to not only enroll in a plan under the Affordable Care Act, but also make sure that they've filled out the forms necessary to find out if they get a tax credit for doing so, that will help us make sure we're building an economy that does work for all Americans. So between now and March 31st, really try to ramp it up to build on the more than 10 million or so Americans who now have that health security and that peace of mind that they didn't have before.
What drives you crazy about that message?
Well, it's not so much the message, because the message is a very positive one. Although I will have to say, although I'm an optimist, I don't believe that the numbers are going to play out as expected or as predicted or as needed. I think what we have to do is we have to start looking at alternatives to this plan. It simply isn't going to pan out. And as you all know, there have been numerous changes to the law. You know, there are laws that are good and there are laws that are bad. This happens to be a bad one. I think we have to look at the results. And the results show that by having to change it so many times to be able to apply it is result enough for me to understand that we have to do a better job. So what we will be doing as we move on, and of course we're going to pass this March 31st date. We just received another delay yesterday on the plan itself. You know, we've got to start showing the American people that there are other solutions to health care coverage. We want every American to have affordable health care. We want families to be taken care of. We've got to make sure that they can continue to see the doctor that they want to see, go to the hospital that they want to go to, and have the affordable care plan that they choose, which is patient-centered, where they're making the decisions with the doctor, not the federal government coming in and doing so. With all those plans that have been canceled, you know, there are a lot of moms out there that are saying, where am I going to take my child? I have that trusted pediatrician that I've gone to for years. What are we going to do? We've got to give some certainty back to the American people on this issue.
Andy, as someone who is you don't endorse the specific law, but you're an advocate of coverage and expansion coverage through our Judge F. When you hear this dialogue, or it's not a dialogue, it's two parties talking past each other. I mean, the two up here are cordial, but in general in Washington we see them talking, and talking is sometimes too polite a word for what we hear. What goes through your mind as why is this difficult?
Well, clearly there's a difference on the politics, and there's a difference with respect to their position on the law, but I'm pretty sure, looking at the records of everybody here, and actually probably everybody in this room, they share the foundation's commitment to a culture of health. And critical to that is coverage. And people here, everyone has had experience with family members and friends who have been uninsured. And we now have this extraordinary opportunity over the next few weeks to help our family, friends, members of our community get financial help to get health insurance coverage. I would say, sure, there are problems with the law. We see these problems every day. We see it in our colleagues and friends who are having difficulty. But there is this opportunity. So for the next few weeks, let's join one another and get information to our friends and to fellow citizens about how to get coverage, how to enroll in the law. When that is done, we'll have ample opportunity to assess where things are, what the problems in the law are, and make changes. But for now, let's get out there and help people find coverage. And the foundation is launching a new campaign, has recently launched a new campaign called financialhelpforhealth.org, financialhelpforhealth.org, where you can go and you can learn about the resources and subsidies that are available for people to help buy affordable coverage.
Steve, what are you not hearing? You're someone who focuses a lot on costs.
Yeah, I focus a lot on costs. I focus a lot on the numbers. I don't hear the pathway of how you get to 7 million people that are going to be newly insured in the private health insurance market for the first time come, whether it be March 31st or when we actually do the accounting, say, in April. I hear a lot of numbers going back and forth that are spin. I hear a lot of statute that more or less is falling into the movie rubric of the Pirates of the Caribbean, where it's not really a pirate code per se, it's their guidelines. It seems as though statute has become guidelines. Rules don't count. I find that there's a strange irony, since I worked on both sides of the aisle, that this law is becoming more and more and more like the McCain plan of 2008 and nothing like what it originally might have morphed from. When you figure the Medicaid expansion basically made Medicaid expansion optional because of the Supreme Court decision, when you look at most of the delays are changes in the regulatory structure for health insurance that more or less look more like a Republican design at this point if those delays stay maintained than anything else. I mean, I honestly think the way it's actually rolling out is a vindication of the Republican design.
The House Republicans have talked about, it's been almost 4 years since the law was passed, another 10 days or so is the anniversary. We've seen the repeal, we haven't seen replace. You were on a bill, and yet it has not gained traction, or not traction to get it to the floor. The bill that you're on contains some elements that people agree on, but it hasn't. Speaker Boehner was very equivocal this week about whether we actually would see any kind of actual replace plan. So what is the obstacle? What do you see? Why can't you get your colleagues, or why can't they get you on a plan that actually can put the House Republicans on what we would do instead of some of these talking points we've been hearing about?
Sure. And that's the key. These are solutions to health care coverage and making healthcare more affordable that have been out there for years and years. I mean, these are not new ideas. Unfortunately, they've never been implemented before. We've got to have some political courage here, and I have put myself behind the plan, the RSC plan, the American Health Care Reform Act, and I just do believe that it has the components that will be able to allow for affordable health care into the future, but also take care of those that cannot take care of themselves. To the point about how do we coalesce all of the Republicans together?
Or at least 218.
Well,
right?
exactly. And as you know, sometimes it's like herding cats with us as Republicans. You know, we've got to come together on a plan, and it may actually end up being multiple bills that we vote on. It may not be just one comprehensive bill. So what we're going to do moving forward is we're going to lay out, you know, what was promised in Obamacare, what has worked, what hasn't worked, and then our solution. So there's actually going to be more of a discussion going forward where we're reaching out to our colleagues, but also to our own constituents, and laying it out so that the facts are known, that we understand the issue, and then we'll choose the right plan moving forward. There are a number of plans, as you know, that are actually offered as far as the healthcare solutions. The 2009 plan, which was the alternative to Obamacare, being one of them. So, you know, we're going to ultimately come up with the right decision for the American people with the American people.
Congressman Becerra, you've heard these crossing state lines malpractice from high-risk pools, which there is some. There have been high-risk pools in the ACA. You know, what does it look like to you on the opposite side of the aisle when today will be, I think they're counting it as the approximately 50th vote to delay the mandate the individual mandate for a year. What do you see in this?
It just reminds me of how difficult it is to enact important legislation and how to get things done. Remember, we're about to reach the 4-year anniversary of the Affordable Care Act. And I think Renee makes a very good point. We should be trying to look at all the different ideas that are out there, because there's no doubt that the new health security law can use improvement. There's no doubt that we're going to continue to tweak the health security law so that it works for all Americans. And no doubt we're going to try to do everything we can to scour the country to make sure that anyone who doesn't have insurance who could qualify will get the most affordable policy possible. But it's easier to say you'll do it than to actually get it done. And that's the landmark achievement of the Affordable Care Act. We got it done. And so we could talk about all the great ideas that are out there and for 4 years have not helped those millions of Americans who now have health security. Or we could try to continue to talk about how to make it better. But as Andy said, let's keep working to help those Americans who are a paycheck away from filing for personal bankruptcy because they just took their son or daughter to the doctor or the hospital. That's what we should be talking about, because if we do that, then we've really dealt with people's insecurities, and there are a whole bunch of them these days. We want to try to make it so folks don't have to worry about whether health care is going to drive you into bankruptcy. And the Affordable Care Act made it possible for us to say, like that home run hit by Babe Ruth, you can tell it goodbye when it comes to personal bankruptcy because of health care. For millions of Americans, that's no longer the story that they will write. That because they took their child to the doctor or the hospital, they know now that they won't have to go personally bankrupt.
Steve, when you look at the point you just made, that there are elements that are McCain-like from 2009, there are certainly elements that were moderate Republican ideas in the early 90s,
right.
the Chafee Plan and so forth, Dole. Do you see that there are these elements that people at one point used to agree on and have ceased being able to agree on? And once we get past, I mean, there is an election, do you see any point where people will sort of acknowledge, okay, here's where we don't agree, but there are actually some people with institutional memory might have a different view of what's in it and how people have responded to it?
Yeah, I do see those things actually starting to occur even now, because there are ideas that are coming up. I mean, the Hatch-Coburn bill that came out, or at least the proposal that came out, actually is almost a return to some of those ideas that haven't been discussed for a while. I think some of the Tea Party thrust kind of got curtailed a bit in the fall for a lot of reasons we all know. And so I think that's opening a vehicle to have a discussion. And I think most of the Republican leadership, whether it's Eric Cantor or Congressman Ryan, they want to actually advance ideas. And with actual policies that are attached with them. So there's elements of the individual mandate that was a Republican idea that came back from before that might still be in there. I've actually done some of the modeling that shows that if you can make an alternative where you don't necessarily have to have the mandate, but you do have to have elements that are already in the bill now. Robust high-risk pools, similar to what the risk corridors are trying to do. The subsidies that are available for folks that are income-based will help out a lot. And then the critical thing, where I think there's still a disconnect for Republicans, is how do you finance this? And so for the Democrats, basically there's the Cadillac tax and the excise tax and all these other taxes that are there. I personally think that's not enough money to actually finance what is essentially supposed to go out, both in terms of the expansion. And so the Republicans need to figure out, do they want to re-own essentially that exclusion, or is that still a third rail, thanks to the 2008 political campaigns?
This is a room full of people who are trying to implement this law in their states and communities. There have been a lot of changes, some of which have made life more difficult for them. Some of which they probably could have guessed, but some of them, we had no idea they were coming. And we also don't know what's going to happen in the next few weeks. There's, a lot of the deadlines have slipped in the past. None of us exactly know what's going to happen March 31st. I did not go out of town that weekend. We don't expect there to be, long extensions. The insurers don't have time. But sort of what are you hearing in your district or when you meet the health plans about the practicalities, and what do you tell them? And I'm not talking about the ideology so much right now, but they have to try to make this work. And when they come to the two of you and just say, throw up their hands and threaten to jump off the roof, what do you say in the not ideological, but the getting through the next few months kind of scenario? You want to start?
What I hear a lot from both the insurers and the individuals who are seeking the insurance is, I want to make sure I know what doctors are available, which hospitals are in each plan. And so they're trying to discern which plan gives them what they need most. A lot of folks in Los Angeles haven't had health insurance in a long time. And so they're not accustomed to shopping around for a plan that has various doctors and hospitals and providers in the plan and the policy that they go to. So they're trying to figure out how to make a decision about which plan offers the best services. I also hear a lot that people are trying to understand how much they will have to pay per month. A lot of folks do the calculation at first based on the policy that's provided by an insurance company. They see the rate, and there's a gentleman who's from my district named William Bennett who was paying about $1,500 a month for an insurance policy. He's in his 50s. He's an independent cameraman for Hollywood, and he was paying about a $500 deductible. He shopped around. He found out his income was still too high, so he wouldn't get a tax credit, but he still ended up saving over $600 a month with a $0 deductible instead of a $500 deductible and only a $20 copay per visit. So he ended up saving over $600 a month. He didn't get a subsidy, a tax credit, but he still ended up saving. A lot of folks don't go the final step to find out that they actually get a tax credit. And then when they find out that, I had a lot of folks who were amazed when they found out they had the tax credit because they ended up saving a ton of additional money. A guy named Andrew Stryker from Los Angeles ended up saving about $6,000 because he qualified for the tax credit. There was another young woman, Jade Moreno, who a few weeks ago at a clinic came in. She's very young, but she doesn't, through her parents, she doesn't qualify for insurance. She had gone to the emergency room a few weeks before, and she got home and she had a $3,000 bill. She said, I don't know how I'm going to pay this. So that prompted her to take a look to see if she qualified. She indeed qualified for health care. She now has it. And she said, you know what, my sister, who's around my age, also is in the same circumstance. So she said, now I'm going to tell my sister she can also get health insurance. So it's not having all the information in hand. But once they do shop, and fortunately now you can shop and find the information a lot quicker than you did back on October 1st, people are finding out that they can get good, affordable health care that gives them the security they need.
What about the health plans, though? Because they're the ones implementing. I mean, in California, you do have robust participation. You do have the insurers did buy in. It's not just one company the way it is in some of the more rural states. What are you hearing from them, and what do you tell them? Because the rules were changed, things were delayed, things were moved. They have to not just get through this year, but figure out what to do next year, and they don't have a lot of time. They have until May to do that. So when the industry comes to you, what's their complaint, what's their confusion, and what's your response?
And Joanne, maybe it's a little different for California for two reasons. One, we've had HMO penetration in California for a long time. And so we've had this model of healthcare throughout California for quite a long time. Everyone thinks of Kaiser as the model for HMO. So it wasn't something strange for California to try to adopt the Affordable Care Act's model because it was based on, really on an HMO. So one, we've been doing HMOs for a long time, so that wasn't a difficulty for the industry. Two, California, unlike some other states, didn't hesitate to try to adopt the Affordable Care Act and start its own exchange. So we were up and running right away. Our exchange probably is the most successful of all the exchanges, and so there's been a lot of time over the last 4 years for the industry, the health insurance companies, to be working with the state California covered program to try to make sure it works as seamlessly as possible. So that the result is that we've got really good numbers, a lot of folks who've qualified, and less of the hiccups that you may have seen in other places because we've been working pretty closely with the industry for quite some time.
And in North Carolina, what are you hearing from, I mean, your state's been very opposed, quite adamantly. What are you hearing from the health plans and what are you hearing from consumers?
Well, first I'll start with the constituents. Obviously that is the most important. And I'll just start by saying, one, the difficulty getting onto the website initially was a big problem because there were those who wanted to get on, especially those who had lost their health care plans. 473,000 health care plans lost in North Carolina. Coverage that those families liked, chose, afforded, and kept going with. And then to find out that their plan was canceled, the first question I was getting is, well, I don't understand why my plan was canceled. This wasn't what I was told. I thought this was going to be to help those who didn't have a health care plan. I didn't think that my health care plan that I chose was going to be affected. Secondly, it's the premium skyrocketing. I have a gentleman in one of my counties whose cost went up from $200 plus to $900 plus per month. And if the premium per month hasn't skyrocketed, the deductible has. Many folks out there do not understand what that means, that is going to be out-of-pocket cost. And I'll tell you who's going to suffer the most are hospitals as a result of that, because people just simply will not be able to pay. But having said that, I just continue to reassure them that there are other ways to go about this, and they are signing up. Now, I also have a gentleman that I spoke to just yesterday who owns his own business, very successful, self-made man, and employs over 50, a couple hundred actually, and the choices that they had to make because they actually had a grandfather plan. The uncertainty that's out there, their costs are skyrocketed. He's trying to do the right thing. He's trying to do what is right for his employees and go forward with a plan to extend into the future, but even he was forced into having to make some decisions that he may not have wanted to make. So I guess what I would say is there's just so much uncertainty out there as to what is going to happen. Our constituents are very worried, but our insurance companies are as well. In North Carolina, we're basically down to 2 different insurance companies that are a part of the exchange, which, as you know, limits access for patients. So, we're still playing out the questions, and as we receive those phone calls from our constituents, we're trying to help in any way that we can. But unfortunately, I can't even offer them the reassurances that they need.
Let's go to next year. The new sign-up period, there will not be a repeal before November, and one could argue that there may not be a repeal after November. Even if the Senate goes Republican, the second-year enrollment period starts, I forgot the exact date, but roughly November 15th. It will exist. People will be covered. We don't yet know who's happy and who's unhappy after a number of months of this experience. We will probably hear the extremes on both sides. And maybe most people will be not many people love their insurance company, sorry. But it will be a reality on the ground. And Republicans will continue, presumably, trying to get rid of it. Obama will still be in the White House. What are some of the practical factors that the two of you see in moving toward year 2? Despite, the political drama is not going to subside between now and Election Day. But there's an on-the-ground moving forward. We don't want November 15th, and I may have that date wrong by a week or two, but is it the 15th? Nobody on either side of the aisle wants to see it look like October 1st. What has to be done to smooth the path? Anne, do you want to start?
Yeah, sure. So, yes, we're very grateful it's not October 1st, 2013 anymore. And We're all grateful to have moved way past that. And I think of the challenges down the road. Information systems at the federal level for FFM states and SBM states is probably not the place where we have to have the greatest worry. Right now, our systems are such that we are enrolling millions of people. Are we going to reach CBO projections? We don't know. And that's the point. There's actually a lot of things we don't know. The stories that we're hearing are really important. They do tell us a lot. But over the next 6 months, after this open enrollment period, after the first one, much of our time is just going to be spent looking at the data. And I can assure you, that's going to be a lot of what Steve does and a lot of our colleagues at the Robert Wood Johnson Foundation do. Find out who the people are who are enrolled, what their health condition was. This meeting couldn't be at a better time. The plans have played such an important and positive role in getting to where we are. And you're an incredibly important litmus test. How will plans respond? The other thing, it's going to be different in every state. The Urban Institute put out a report yesterday looking at implementation across 8 states. And it's very different depending on how states approached implementation. And they all have different decisions to make, and it's all resulted in different outcomes. But down the road over these next few months, states are going to be looking at things like making sure that there's seamlessness across eligibility systems for Medicaid and the exchanges to make sure that there's no churn. People aren't dropping coverage. We're going to be looking at plan participation, working closely with plans to make sure that there's sufficient competition among plans, and to be looking closely at premium rates. In other words, the end of this open enrollment period, I'm afraid there's no rest for the weary. It is going to keep going on, and it's not only going to go on through November 15th. This is going to be a many-year process until it really gets into the culture of our health system.
Steve?
So yesterday I opened up my little iPhone, I got this email from the Morning Consult. A former student of mine puts this out all the time. It's a great thing. And it mentioned that the mandates, or not the mandates, the restrictions will be postponed in terms of what the plan designs will be. Probably of all the things I could think of that will help 2015, that's the one. I actually applaud the administration for recognizing that they need to pull back, because in my own research I've shown that you're literally millions of people potentially could lose their coverage if you actually enforce that restriction. The restriction, I think, was there in part to demonize, or at least not really fall in love with high deductible health plans. For better or for worse, the country did fall in love with high deductible health plans over the last 5 to 6 years, not because they liked having high deductibles, just because the premium is affordable. And that's just a reality. It's in terms of just modeling these things out. I think that will ease the burden a lot going into 2015. What concerns me about 2015 is a lot of the unknowns that I think a lot of the plans have to deal with here. I have no idea how much of the money is actually now rolling to the plans to pay for the subsidies that they're actually getting. The way the ACA is working is essentially an instant coupon clip savings when you go through the exchanges. As of a month ago, I was sitting on a panel similar to this with some folks from Kaiser. Kaiser had yet to receive any money yet. They're basically operating kind of on spec for all the people that they're actually taking in. So the accounting of that is something that's needs to be worked through. I'm sure this is something that probably members of the House will take a look at to say, how did the money actually move at the end of the day? And they should, regardless of what party you're in, because it's not necessarily operating to the wonderful back office systems that are there. I mean,
They're not there.
they're not there. I mean, that's the biggest concern I have, is that what happened on October 1st, in my mind, is completely inexcusable, because e-health insurance already proved that model was possible 10 years before. What needed to happen, and still hasn't happened, is a back office system that works across 5 federal agencies that is actually bulletproof and seamless, that can move money and data. And if that isn't at least 50% closer to where it is now by the end of 2015, I don't know how the plans keep offering premiums at all with that level of uncertainty.
Before we open up to questions from the audience and have some from Twitter, I want to go back to something you said, which was you tell these anecdotes about, he didn't know he could get this, or she didn't know she could get that, or this was a surprise, or I had to tell them for this. After 4 years, why don't people know that? The administration's had 4 years to explain this. The public is very confused. The other side, the Republicans, have been very clear. It is easier to attack something than it is to explain something. If it was the other way around, the Democrats might be the ones whose message was, it's easier. It's a big, complicated law. We have to look things up all the time because I can't remember all 1,000 pages of it. The Republican message has been very clear. And we've actually done stories analyzing social media. The anti-ACA message is a lot more prevalent and a lot more easy to grasp. Why do you have to have people coming into your office who after 4 years, don't know what's in it for them?
Joanne, the answer is very simple. As you would know, we didn't start to have plans offered where people could actually see what the rates would be until October of last year. The insurance companies, right after we passed the bill in 2010, couldn't tell Americans what they would charge for these plans. Everything had to be set up. We didn't know how many states would participate with their own exchanges and how many would default and let our federal government create the exchange. So there was no way to tell Americans what they could expect to sign up for until everyone, the insurance industry, the doctors, the hospitals, and our federal government had participated coming up with the actual exchanges. So
but the basic concept was out there. People didn't know there were subsidies. People didn't know there were tax credits. People didn't know.
Well, that's the difference between government and the private sector. We don't spend money to market a lot of what we do because it's taxpayers' money. And so we try to use it to provide a service versus market. But there is marketing money in this bill. The states have contracts, they're PR contracts, they're specific contracts. Certainly not the kind of marketing money that you would need to get the word out to tens of millions of Americans. But a really important point, if I could make a really important point, I think, on the stories, and with all due respect to Renee and any of my colleagues, well, actually, let me ask it this way, Joanne. You must have health care, right?
Yes, I do.
Okay, what's the name of your government doctor?
I don't have a government doctor.
Well, you must have a government doctor because this was a government takeover of health care. And so that's what we were told. We were also, how many people do you know, can you name, died as a result of these death panels? Americans were convinced that there were death panels in the Affordable Care Act that would require people to be allowed to die. Nothing. And so, with all due respect to Renee and folks who say that there are some difficulties, I gave you names, first name and last name of individuals, because I asked these folks, can I use your name? Because we saw what happened when one of our Republican colleagues tried to talk about this horror story on the Affordable Care Act and use the example of a woman in Spokane named Betty, who had a terrible experience and had to pay a whole lot more because of the Affordable Care Act. When folks checked up on Betty in Spokane, they found out she never even went on to the exchange to find out what she would have to pay. And so when I hear stories about some guy paying $700 more in a premium, give me his name and let me check. I don't believe it. And what I do know is that William Bennett gave me his name. Jade Moreno gave me her name. Andrew Stryker has been all over the press in Los Angeles. And so let's talk the truth because we're spooking Americans. These health scare stories should stop because we want to give people health care and the security they need. And then let's fix the bugs. Let's get rid of the kinks. Because what we want to try to do, as I said before, is build an economy that works for all of us. Not just for those of us who can afford the insurance, but for all of us. And we should stop this where half of all personal bankruptcies are due to a health care bill. It's time for that to stop.
Did you ever go to the administration and say, I need you to make it clearer?
Yeah.
Okay. And what did they say?
We're working on it.
Okay. Do we have a mic in the room for questions, or are people just going to stand up and... I'm not sure if okay, we have a question here. Do we have a mic coming over? Yeah. And we've
by
got
the way,
some
as you
Twitter
get to that
questions.
question, we had about 20 sessions with the administration over the last couple of years that I've been chairman, trying to just work with the administration to find out how they were going to implement the Affordable Care Act.
Rep. Becerra, I just want to make sure I heard you right. Did you say that the government has not spent any money marketing ACA?
No, I did not say that.
The federal government, or are you trying to discern between the federal government and the state government? Because last I checked, hundreds of millions of dollars have been out marketing ACA. I was at the local union market last weekend where government reps were out marketing ACA.
As I said, I just agreed with you. I never said that they didn't spend any money. I said we're not spending the kind of money that a private sector enterprise spends to market itself. If you want to make comparisons, we can. Whether it's Wall Street or whether it's food production companies, the type of money that's spent, because remember, do you use Tide or do you use All? Do you use Crest or do you use Colgate? Chances are you've seen the commercials for those different products scores of times on television. And what any good marketer will tell you is you got to repeat it over and over again before you're driven to go to that particular product.
May I respond to that too? I think to my colleague, he's making the very point that we as Republicans have been making all along, which is these are the types of things that need to remain in the private sector and not government run. I mean, to the point of government doctor. Well, there are government doctors, but what's more important is the government is telling you who you can go to and who you cannot. And if you like that doctor that you went to, now you can't anymore. So, to make the complaint that this hasn't been marketed well enough, I don't know. I saw Pajama Boy. You all did. I don't think they've done a very good job. But they have had 4 years to implement this. So the point is when is too much too much? And how are you not effective at what you're doing? The federal government simply cannot do this and put it forward as a private sector operation when it is just that, government run, government control. That's exactly the problem here, and that's why it is fundamentally flawed.
Joanne, can I just
Sure.
respond to this? I'm not sure, necessarily the problem is there's not been enough information out there. The problem has really been that there's almost too much information, and it all conflicts with one another because we're in the middle of a political battle that's been going on for 4 years. But more than that, it's also the nature of the law. It is a complicated arrangement. If this were a government takeover of our healthcare system, it'd be pretty simple, and people would get it. They might not like it, but they would get it. And that's not what this is. And the law has gone up and down. We went through a Supreme Court decision that made changes to, say, how Medicaid would be expanded in states. And there's just been so much noise. And I'll just go to where we started this conversation and say, look, for the next few weeks, folks, let's sit back, stop the noise, focus on the opportunity that Americans have for the first time who are in the individual market who can buy health insurance without concern to a pre-existing condition, who can have guaranteed issue, who will not have caps on coverage, on cost, and help them get this coverage.
Steve?
One quick, I think to answer what your original question was, the reason why it's been easier for the Republicans to market kind of a message versus what the Democrats is that the Democrat message, I hate to make it, because there's just such a wide variation in terms of what the intent is from different parties and how it actually gets marketed. So that the simplest message that essentially played for political theater is, we're going to get you all covered and we're going to have national health insurance for everybody. Even the Democrats embracing from time to time, including the president, Obamacare, basically says it's like Medicare. It's like we're now going to all have health insurance. We're all going to have health care. And yet what it really is a largely moderate Republican health insurance reform proposal dressed up with some Medicaid expansion that's optional. And that doesn't sell very well as health care for all.
There's a good question for Twitter for you, Congresswoman. This question says, you said the Republican replace plan would look at, quote, what worked and what doesn't work at Obamacare, and do you think anything worked?
Well, there are things that the American people like about Obamacare, one of which was actually, and I just found this out myself recently, was that the coverage of you're dependent up to age 26. My understanding is the Republican plan in 2009, which was the alternative, actually included that as well. There are many things about Obamacare that I think in intention alone are very good. That's why we want to actually compare. We want to say that, part of the intention was that 30 million people were going to receive health care coverage that didn't have it now. Well, we know that the CBO says that 31 million in 10 years will be without health care coverage. So how do we get more Americans on health care coverage than the Obamacare plan? So that's what I mean by saying, you know, comparing the two, comparing the promise that was made. You can keep your doctor if you like him, you can, or her. You can keep your hospital that you go to. You can keep the plan. And then compare it to the reality. Because I think in this, you know, all along for 4 years, we heard about the intentions of Obamacare, which were all honorable, and any one of us would agree. The problem is the results are not matching up, and that's what we want to show.
I don't recollect any Republican plan scored by CBO, even when CBO was controlling the Republican, it was the Republican control,
And that,
coming up with anything close to 30 million,
I
though.
would not be, you mean as far as the number that will be covered?
Right. I don't remember.
No, and that's
right.
the thing. The problem here is that there are still going to be individuals, no matter what we do, no matter how well we put forward a plan, that are still not going to sign up for health insurance. That's a fact, unfortunately. In fact, my understanding, many of those who were uninsured before have not signed up for health care on the exchanges. It's the ones that lost their coverage who are actually the ones who are signing up, or those who didn't have Medicaid before, could have qualified, and now have gone on to receive Medicaid coverage. So the question is, how do we help individuals be more responsible with their health care, especially young people? What can we do to help them to understand that it would be a good thing for them to have health care coverage? One would be to make sure that it's as inexpensive as possible so that they can incorporate that into their budget. I would call that a health care savings plan along with a catastrophic plan. I think that would be much more economical for our young people and yet get them the coverage they need if something happens.
And in the Republican study plan that you're the sponsor of, how many people do you think get covered through the high-risk pools? Because that's where the tough population goes.
The issue there is the amount of money that the RSC plan, I believe, which was about $25 billion for the health care over 10 years. Now, there are those who say that a high-risk pool isn't something that we should do, but actually I do think it's a very good idea. We have to get folks to a place where they are getting insured again. And, you know, because there's that gray area when you leave a job, when you're interrupted for some reason on insurance coverage. How do we make sure that we are covering those individuals who have pre-existing conditions, but at the same time make it available so that maybe your insurance is portable, so that we start to drop off those who lose health care coverage over time?
Okay. I want to remind the hash mark for questions is hash mark policyconf, C-O-N-F. Some of the ones that have come in we've already covered. Questions from the audience? We've got one here. And stand up so they can see you. Right. And can you identify yourself, please?
Sorry. Dave Sterrett from the Healthcare Policy Group. This question for Andrew. One of the things we're seeing in the exchanges are network adequacy issues. Definitely much narrower networks. And how do you propose addressing that problem going forward?
Well, I think, first of all, we do need to understand what the impact of this is and the extent of network access problem there is. And one of the things we're doing at the foundation is going to be collecting that data, working with plans and working with providers to find out the extent of the problem. The other is, you know, this is not new. Narrow networks is not a new phenomenon that was created by the Affordable Care Act, but it is a trend. And there are also positive features of that trend. There's a natural push to control costs, and this is how you do it and how you create competition across providers. So I think we have to really better understand the extent of the problem, and when and where there is a problem, which will most likely be in particular geographic areas as opposed to a national problem, figure out how to handle it in those particular regions.
Steve, what about the networks?
I think if you're going to expand coverage, you have two flavors. You can do it through narrow networks, or you can do it through high deductible health plans. Actuarially, they're the same. The biggest difference is how much do you value having access to the providers do you want to have access to? I've been an advocate for high deductible health plans for a long time, in part in principle in part just to see what they actually operate in. I've been in an HSA since 2006, but at the same time, members of my family have chronic conditions that can be pretty dangerous, and so I want to make sure I have access to the Mayo Clinic. The high deductible health plan that I have always includes the Mayo. I'm paying a much lower premium than I would pay if I had a PPO design that would include the Mayo, and I'm willing to bear that risk. And I think Americans need to have an honest conversation with themselves and their family members about the trade-offs between a narrow network like Kaiser, basically, that has everything covered, but not necessarily the doctor you want, versus the doctors you want, but you're going to pay some money out of pocket.
Right, and I think that you were the person who explained to me, actually, that most plans are one or the other, that there aren't that many plans out there that are both high deductible and narrow network. I mean, we may have somebody here in the audience who's selling one, but that's not the typical consumer choice.
Right.
So, but I have been seeing, dribbling out of the States, some stories and comments about some of these networks may not be. I mean, some of them is just providers fighting with each other. Some states may really have some adequacy issues.
Yeah, as someone who used to work for an insurance company, I mean, I know and still do some of the modeling for this stuff. I mean, I understand why the narrow networks are getting much narrower than they ever did before, because if you have enough data about providers, you're going to restrict your panel down to a PM-PM quotient that really could isolate where things are going to go. And the ACOs aren't just, they're not there enough so that you have a comprehensive care system that's going to cover everything adequately. Even in Minnesota, where we have 3 or 4 systems that really are ACO-like, they don't cover the metro comprehensively enough to be a complete replacement for the average person going forward, as Kaiser would be, say, down in California.
Okay, another question here? Nobody in the room? Okay, somebody asked a little bit more detail about they called it the Republican policy plan. I mean, the Republicans, as we said, do not have a plan. But talk a little bit about more. You've said these ideas have been around for years. They also haven't been enacted for years, including when the Republicans controlled both the House and the Senate.
Absolutely, and the only thing I can say to that is I wasn't there at the time. So, what I will say is let me give you a list, because I think any one of the plans that the Republicans are putting forward have a culmination of some of these issues. One, I'll go back to the HSAs, the healthcare savings plans. Being able to put away money pre-tax for your own healthcare savings, along with the catastrophic plan. I pointed out that I think that that's a great way for young people to be responsible for themselves. Insurance portability, buying insurance across state lines, tort reform, absolutely necessary moving forward. Being a nurse for 21 years, I will tell you it is absolutely true that defensive medicine is being practiced, and the malpractice insurance that our physicians pay is astronomical. That has to be dealt with as an issue. The thing of it is it's about making it patient-centered, so that we're actually making responsibility decisions that patients and families are making, so that they are more responsible for their own health. I would like to see a system in place where individuals understand what they're paying for in a more transparent way. And there are a number of ways that we can do that. But those are just some of the highlights, I think, for the Republican plan. And I think they achieve the same goals. We want every American to have affordable health care for their families. And there are those who cannot take care of themselves. We talked about the high-risk pool for those who with pre-existing conditions, and the ability to get them from one place of being uninsured to insured. There are a lot of ideas, and that is going to probably be part of the biggest discussion amongst Republicans of how do we pay for that, and how do we go about that. But I think, again, many of these things have been out there for a long time. They're not new ideas. They, again, just have not been implemented before.
Congressman, I will not put Congresswoman Ellmers on the spot by asking her to list all 50 repeal votes. But as you see this, it's the repeal vote of the week, right? It's not going to stop before November. Maybe we'll have a week or two where we don't have one, but that's basically the pattern. It's a messaging tool for November. I mean, they don't really think that the Senate is going to suddenly decide to repeal this and that President Obama is going to say, whoops, I don't really want it after all. How do you get that dynamic to stop after November? Because you will still have President Obama in the White House. It is unlikely that the Republicans, they could take the Senate, they could have 51. Unlikely, I don't think many people are predicting 60. I don't think anyone's predicting 60. How do you change I mean, the Democrats privately know there's some things that have to be changed, as you would with any law. I mean, even if there was bipartisan support, you'd be changing things. It's big and complicated. What in the old days could have been a technical correction is now, some huge battle. What is the olive branch? What do you say, okay, let's talk about this part? How do you stop making us cover the repeal vote of the week every week?
Well, I suspect...
You have to fix SGR too to really make us happy.
And you gave a great example, the sustainable growth rate legislation that tries to deal with how we reimburse physicians under Medicare. It was a bipartisan bill. I know Renee in Energy and Commerce, I in Ways and Means, Senate Finance, bipartisan, bicameral, unanimous. There was, I don't think, a negative vote on that legislation out of any committee in either chamber. And I think that's the prescription to try to get things done. I suspect in 1965, post-1965, this was sort of the discussion we had about Medicare and its implementation. I know for a fact that this was the same kind of discussion we had post-passage of the prescription drug benefit under the Medicare program in 2005, 2006, where there were hiccups in trying to get it going in terms of providing prescription drug coverage for seniors under Medicare. So I think what we want to try to do is get past these gotcha votes, these repeal or dismantle votes, to what I heard Congresswoman Ellmers talking about earlier, and that is, here's how you get there, at least here's how Republicans think that. Chances are you're going to find that Democrats agree with a lot of that. And what we try to do, Joanne, to your point, is we try to improve this, because it's a never-ending process of trying to improve. I think the Founding Fathers would have said the same thing. We created democracy, but we know it's going to have to constantly evolve. And so it's just a matter of making sure that when the American people look at this, they'll say, yeah, you did try to make it better. You just didn't talk about doing it. You just didn't aspire. You actually did things. And hopefully what we'll do is we'll get past this game of gotcha politics and dismantle and repeal to actually trying to improve and make them work.
Okay, that's about it. It's time to wrap up our conversation. Thank all of you for joining us. Thank you for those of you who watched here and on the live stream. Thank you, AHIP, for partnering with us at Politico. And in a slight, not the way we usually do things, we are going to clear this room. Those of you who want to register for the AHIP conference to follow, you can do that outside. There's room for more registrants, and everybody have a great day and join us at our next event.